Well, since we have a quorum, I'm going to go ahead and call the meeting to order. I want to welcome all of you on this Friday morning. Friday morning, but I'm glad to be here with you. And this group would not have been possible without you. Well, thank you all for being here. We're going to go ahead and get started. The roll sheet is passing around. So next up on the agenda, item number 2 is approval of the June 9th McLean County Behavioral Health Coordinating Council. Second. Okay. Yep. Item number 3 then, moving on, is the BHCC. We have a new member introduction. From ISU. Welcome, and if you want to take a minute to introduce yourself.
Having me, my name is Mary Hogger. I am the Director of Student Counseling Services at ISU. I've been at ISU going into my 13th year, been in the director role.
Just kind of bad because we put her off in a corner. Sorry.
Oh, don't set fire. Well, welcome. Up next, item number 4 are kind of presented for information. Item 4A is the YWCA Stepping Stones. Jennifer Gallagher. What do you see?
I don't listen to whatever you think.
Hand over to you.
Yeah. Okay. You can just pop that microphone on right there in front of you. So you can hold it if you'd like.
Jen does not want it. Can you hear us?
Okay.
Can everybody hear us?
Yeah.
Jen does not want the microphone.
My professional presenter.
Not her fave. So hands, I'm curious. I hope that everyone in the room is familiar with stepping stones in some capacity. We are both from YWCA. My name is Alicia Whitworth. I'm not on the agenda. I came as Jen's backup today. I am YW's Director of Development and Public Relations. And so we are here today to talk to you specifically about stepping stones. And as some of you may know, our mission, we are on a mission to eliminate racism, empower women, stand up for social justice, help families, and strengthen our community. And so we do that by through a variety of programs, stepping stones being one of those. And it is the Central Rape Crisis Center for McLean County. And you'll see here, our marketing director made this very cute, very fast, apparently. Timeline. We finished this late yesterday, but I'll give you a rundown of what you didn't just see. Yes, and it does land on the fact that in 2002, Stepping Stones, we took our first hotline call. For those of you who might not be familiar with how Stepping Stones came to be a YWCA program, in 2001, there was an RFP sent out and no one nonprofit could take both domestic and sexual violence. So our friends over at MCCA took the domestic violence side of things and YWCA took Stepping Stones, so the sexual violence side of things. And since 2002, we have provided the rape crisis services for McLean County. And through that, we provide prevention education as a part of Aaron's Law, which requires prevention education for public K through pre-K through 12 students, a 24/7 hotline, medical and legal advocacy and counseling, all of which is free and confidential to everyone we serve. Prevention education, for those of you who are not familiar, Aaron's Law requires public schools, like we mentioned, to provide that prevention education for pre-K through 12. So our prevention educators go into schools throughout McLean County and provide that education. We have a lot of conversations with educators who are honestly thrilled to not have to have one more thing on their plate and have our experts coming in to teach those kiddos. When we look at the stats and why this is critical, 1 in 9 girls and 1 in 20 boys younger than 18 will experience sexual abuse or assault in their lifetime. When we go in, we use a healthy relationships curriculum that's adapted from the Second Step Child Protection Unit by the Committee for Children. And in fiscal year 23, which was our last fiscal year ending at the end of June, our prevention educators reached more than 8,000 students through more than 1,100 presentations in McLean County schools. And if you're familiar, you know, McLean County is obviously the largest county by square mile in the state of Illinois. So that is a lot of drive time for our educators who are committed to serving. It's not obviously just Bloomington Normal, all of our rural communities as well.
And one thing that we didn't put on there is we also offer professional training. So our prevention educators also work with the universities. They provide sexual harassment training to local organizations. They also they work with student groups. So we go to like groups of athletes and talk about consent and things like that. And that just continues to expand. And as we'll see later, our funding has decreased significantly. So it's become really hard to meet the need of the community. All right, so we also have that 24/7 crisis line. It runs 365. It is typically run by volunteers and staff. And as you'll see in a later slide, the volunteer trend is decreasing. I think that's a pervasive issue across the state of Illinois. It's not just our organization, but it's really hard for people to, they're just being more protective of their time. And so it's hard to recruit them at this point in time, but we have our trained and caring advocates that are available 24 hours a day, 7 days a week. And again, the services are free and confidential. So the folks that are operating our hotline, they not only are responding to crisis intervention calls, but then the hospital call outs that come through the hotline as well. We provide legal advocacy, and so that is civil and criminal. So we can act as liaison between the state's attorney, the police departments, and the court system. We attend status hearings with our clients or on behalf of them. A lot of the clients don't want to go to the status hearings for obvious reasons, right? So we will go on their behalf and provide them with real-time updates about what's going on in the case. We can help them with the no contact orders, crime victims compensation, reading their victim impact statement, helping them create them, just being there as a support person through that entire process. Okay. And then we do the medical advocacy. So this is any time someone presents in a local ER for an evidence collection kit following a sexual assault. And that can be anytime, day or night. So we always have to have someone available and ready to go to the hospital to respond to those. So following the passage of SECEDA in the state of Illinois, all hospitals that are treatment hospitals must have an MOU with a certified rape crisis center, which here is us, to call us immediately when someone presents there. And as long as the patient agrees to have us come in, we will be there to provide support throughout the entire process, letting them know their options. There are a lot of options they have to choose from the pieces of the kit that they want to do, whether or not they want it to go to processing, whether or not they want to report at the time or later. So just helping them process those choices, being there as a support person, and then supporting the choices they make. We're not there to tell them what the right choice is. We're there to just support and advocate on their behalf. Yes, and so it continues after the initial medical contact. So we would help if there's any billing issues. They're not supposed to be charged for anything. They get a voucher that provides free medical care follow-up for the next 30 days. So making sure they get that, and that the places that they're going to use the voucher are accepting the voucher. So kind of navigating that process with them as well. We don't have a slide for our general advocacy, I realized, but that's another thing that we provide. So it's kind of a case management style. So helping with medical advocacy, legal, and then any other things that someone might need. As you know, like sexual violence can affect many areas of someone's life. It's not necessarily anything, anything that we can predict. So if someone needs clothing, food, help with their employer, if they need their locks replaced,
even people who are moving. So we partner with, I always like to throw them out. 2 Minute Truck moves our clients in crisis at absolutely no cost to our clients or to YWCA. So if someone needs to leave their situation, we do have funding available to put someone in a hotel, for a short amount of time to get out of the crisis. But then we also have the means to help them move to a new place if they need to do that, if they're fleeing their oppressor, basically.
Yes, we always tell our clients, whatever your need is, you just let us know. We will do our best to help you or find you the resources within the community that can do so. So it's a really holistic approach. We're trying to help them improve and heal all areas of their lives. And then we have our counseling. So we have the free and confidential counseling. We have individual counseling and group. And someone's sexual violence could have happened at any point in their lives. It doesn't have to be recent or within a certain time frame. You can be an adult and have it happen when you were 5. Yeah, we don't turn anyone away. So, but as you'll see on the next slide, currently We have a wait list of over 60 people, which is really, really hard. I don't typically do intakes any longer, but I did one recently. And it was someone who had just been through a really horrible sexual assault. They were experiencing severe panic attacks, and I, was there to help support them, and then had to tell them that they were number 62 on our waiting list. And that is just really hard. We've had a waiting list in the past. It's just never been this substantial. And some of it has to do with the funding cuts that we received, which we'll get into a little bit later. But it's heartbreaking because all of us are so passionate about helping our clients and supporting our community. And when we have this, it just feels like we're not able to do it as effectively as we want to. And like the people accessing our resources and requesting our services has been continuing to grow. And then unfortunately, when we're getting less money, that makes it really hard to continue to provide the support that the community needs. We do services in the rural community as well. So we have the prevention educators have had relationships with Libya, Ridgeview, and Leroy. We do healthy relationships in the El Paso High School. Right after this, I'm actually going to Lexington to meet with the social worker there to talk about our curriculums and see if they want to work with us as well. We're actually down an educator to do the budget cuts, so they're stretched pretty thin. So hoping we'll be able to accommodate this new relationship. We also can provide any of our other services in the rural community. So if someone calls and they cannot get to us, we will go to them. We will do whatever we can to make it work. We've gone to schools and other communities and provided crisis intervention or counseling. And then our virtual counseling option, it helps reduce that transportation barrier for anybody who is outside of Living to Normal or just can't get to us in general. And so talking about our volunteer trend, so pre-COVID, we had mostly college students and had a volunteer pool of about 10 to 15 on a regular basis. I was doing the volunteer training in February of 2020. We had probably about 12 folks in that training. They had just finished, they were ready to go. COVID hits, they all went home. So then we're down to nothing. Essentially, we had about 2 longtime volunteers who have been with us for a long time, and they have continued. But since COVID and everybody dispersing, it has been very, very difficult to retain volunteers. And how that's impacting our hotline and our staff. We have staff on what we call backup. So we are essentially supposed to be just answering questions for the volunteers that are covering the after hours and the weekends. What's happened is now there's no volunteers, or maybe 3 or 4 nights are covered for a month. And then our staff who are supposed to be backup are working full time, doing the counseling, the advocacy all day. And then they're on call for a week at a time and going to the hospitals in the night, answering the crisis calls. And it has been very difficult, to say the least. And as we have been reducing in staff, there are less folks available to make up that difference. And so it has been a very trying summer. It's been hard on all of us. Some things that we have done to help encourage volunteers is we do offer a stipend to people for taking shifts. So they would get $35 just to be on call for the night. And then if they actually go out on a call or hospital call, which can last up to 8 hours. So again, as you've got staff working an 8-hour day and then going into an 8-hour night over and over again, that's pretty hard to maintain. But we do offer a little bit of incentive. I think that we're starting to get people back interested, but it's still a hard process. It is a statewide issue. The rape crisis centers all over the state have talked about this. I go to a statewide meeting of directors from across the state, and everyone is kind of in the same boat. Asking ICASA, which is the Illinois Coalition Against Sexual Assault, what do we do here? Our staff can't maintain this. Their solution is to apply for a temporary suspension of services. So we would cease to provide services after hours on weekends for up to 3 months while we recruit. But we, as a staff, have decided that we don't want to do that. We will keep moving forward, keep doing what we're doing, and just trying to get more people to help us and more funding to add staff to help alleviate some of that burden.
And it's really it's all hands on deck. We have board members taking this 40-hour training. We have staff like myself who are 40-hour trained. during the pandemic, but have never needed to work a shift, then we're signing up for shifts as well. And it's just a really imperative. It's a really imperative volunteer work in our community. And I cannot imagine, working with Stepping Stones directly every single day. There was my very first shift. Jen knows I was 5 to 8 a.m. and the phone rang at 5:01 p.m. and it was a hospital call. And I needed the next morning off to regroup. And so to just have this consistent pressure on one little pocket of staff, it's just not sustainable. And we'll talk about, funding trends and all of that as well. But this was an unexpected cut that took place to Stepping Stones funding, resulting in those unexpected. So she mentioned a reduction in staff, and I want to make sure that that was very clear that that was not our choice.
Yes.
Not something we would have done.
All right, so our funding trend, how our funding works is that we're the sub-grantee of state and federal funds through the Illinois Coalition Against Sexual Assault. They receive a pot of money from these various sources, and then we write an application to ICASA, all the centers across the state do, and they decide who gets how much money from each funding source. Every 3 years, it's a competitive grant cycle, so we would have stable funding for 3 years at a time. This past fiscal year was a competitive grant cycle, which had its pros and cons, I guess, because this is when we got the cuts, but then we're all writing for a competitive application with 50% reduction in VOCA money. So it impacted the other funding sources that we get, and everyone was struggling, to get the money. It was hard. So we have 7 different funding sources right now that are passed through ICASA. It's complex, to say the least, as we're writing the grant application and trying to justify, because each funding source has different allowable services, and so it's a big, anyway, you understand what I'm saying. And so VOCA funding given to ICASA to distribute was cut by 50% for FY24, so it went from 18 million down to 9 million to disperse throughout the centers. And so this will show you the different funding sources that we have and what they were last fiscal year, what they are this fiscal year. You will see that there's 2 additional ones, the SSBG and VOWA-SAS. We had nothing for FY23. That's because they weren't a thing at that time. The SSBG is a social services block grant, and Carrie Ward, the CEO of ICASA, had petitioned to the state of Illinois to kind of make up the difference. The general revenue is what comes from the state. So she was asking for an increase in the general revenue funding, which they weren't able to give at that time, but they were able to pass through some federal funds, and they gave the coalition $5 million. So we got an additional $148,000 through SSBG, which made up some of that difference, as well as the VOWA-SAS. And as you'll see that, they gave us $31,000 in VOWA-SAS. We were trying to add another full-time counselor to our staff. The $31,000 is not, so it's kind of created a situation because now we're going to hire a counselor in probably November, but then what happens next fiscal year if everything else is remaining the same? Now we have to make up the other half of that salary. So not sure what we're going to do about that yet. That is a problem for later. The Attorney General money, we applied for that independently as an organization. That did increase. That pays for one of our advocates, so that was helpful. But there is still a difference. And the ARPA money, we will get another $50,000 in FY25, but after that, that money, we don't know what's going to happen with that. That was a special American Rescue something act. Sorry. So we're not sure what's going to happen with that. So we're looking at, we have some help here, but then it's also created some more problems potentially down the line that we're not sure how we're going to fix. So we're still underfunded from where we were as our program is continuing to grow.
And I'm going to pop in because in our lack of caffeinated state, we aren't sure there's an expansion slide on here. So I'm just going to pop it in there.
It's early for me.
My children were not awake when I left. So when I'm sure that many of you have heard that we are also in the middle of an expansion campaign for the program. And I understand that those two things seem very opposite, to be standing before you requesting and needing programmatic funds to run the program itself, but also soliciting funds from our community for an expansion. But this is really a situation where two things can and are true, can be and are true. So we cannot serve those 62 plus counseling waitlist clients in the space we have now. We also cannot serve those waitlist clients without additional counselors and advocates. So we're really in a bind. We know that this expansion has to happen. And I know that some of you have seen the current space and toured that. And if you have not, we do have an open house on September 15th, some chunks of time in the morning and then in the afternoon. So we can hang out again if you'd like to come on over. But those spaces, for those of you who are not familiar, we were in the health and fitness industry. So our counseling rooms are spaces that were former lifeguard offices, vending spaces, like the cute little wall that rolls up. Like we made a bookshelf because we're scrappy, but we have done the best we can with the space we have for as long as possible. These spaces are not soundproofed because a lifeguard office doesn't need to be soundproofed. A birthday party rental space doesn't need to be soundproofed. If it tells you anything, when Jen and I have been talking about the expansion, we had a meeting with the architects and I mentioned in passing something soundproofed, and Jen got teary because we don't have to have sound machines outside of rooms, literal baby infant sound machines that we tiptoe around. We've got children through childcare who play in our gym. Our gym is catty corner to our counseling rooms right now. Our building was not built to house this program, but we've done what we can because we owe this to our community, and it's truly for our community by our community. So this expansion will happen. I'm manifesting it. We're going to break ground this fall. And we will have a private suite for stepping stones. And our focus for that is confidentiality, accessibility, all of these pieces that we can access that we don't necessarily have right now. If you were to come in right now as a walk-in client, you're sitting in the waiting room that I walk through as a staff person, Jen walks through, deliveries are brought through. It's not confidential. When this renovation is complete, they'll walk through to a private reception area and then through that to a private waiting room. So we have layer upon layer of security there. There's a private restroom, there's counseling rooms. We're doubling our counseling space through this renovation. We'll have a private hotline space. Right now we're knocking on a door to come in for something like, is anybody on a call? Just to make sure that privacy is maintained there. So just wanted to really touch on that because I understand that that can be very confusing. An organization asking for money, but you're also in an expansion campaign. And for us, we were in the middle of this campaign when those cuts were announced by ICASA. Those took us by surprise. So we were not in a position to stop that funding. And then, as you know, when funding is earmarked for capital expenses, we cannot turn around and then hire counselors. So very, very complicated, but we're going to do what we need to make it happen.
I thought of something else I wanted to add as well. So sorry, everybody. But when we found out about the budget cuts that were impending, what we did was strategically, as folks were, moving on to a different place of employment, we would just eliminate that position. So that way, when it came time for us to get our funding for this year, we didn't have to cut staff. That was the goal. We didn't want anybody to lose their job. So there was 2 counselors that had left and an educator. So we eliminated those positions. When it got our application back, we received less. We didn't ask for our full funding amount. That would have been not realistic. So we had asked for a reduction. They cut us even further than what we had asked for, which made sense because we asked for a little more than the 50% cut. So we ended up having to let go of a staff member who was just the last person hired. So that was pretty difficult, not gonna lie. But thankfully with the SSBG money, we were able to hire that person back. So we're still operating with less staff. It's 3 positions that are still, that we still haven't been able to fill. Yeah, that's all.
What program trend?
No,
she said no. And honestly, if you see here, we decided to break it down into chunks of really 10 years. So 2003 to 2013 to now, and you can just see the exponential increase in hospital calls, counseling clients, and hotline calls. It is not a pace that we can keep up with at the current staffing level or even the size of our program space. And when we look at, there are a lot of reasons that more people are disclosing. You cannot extrapolate that data to say why, or even that it wasn't happening when we weren't getting as many hospital calls. People are feeling more comfortable. People are seeking services. And in our community, we need to be able to respond to meet those service needs. We do serve individuals as young as 3 years old, and I often want to repeat that in meetings like this. And we also, I know that the media likes to portray what a survivor of sexual violence looks like, and that looks like anybody in this room. And so when we discuss the need for that need is great. The need spans our entire county. And we're just really grateful to be able to talk to you today. That is the expansion piece. So again, safe, accessible, and confidential. And as you know, behavioral health is a crisis in McLean County, and it is a true crisis for survivors of sexual abuse and assault. This is where they would walk in right now. Getting director got cutesy yesterday. She was feeling apparently like a video. I told her that if I had done this PowerPoint, it would have looked like my 6-year-old scribbled. So these are our very official slides. Like if you see here, this is our staff room. So our grants cover things. They have to move. That does not cover capital. Cute little sound machine. That's how we maintain confidentiality.
Does that block the sound from coming into the room, though?
No, it does not. Yes, quiet, please. I think that might be the end of that. If it's not gonna, yep. We'll call that, I was gonna say, call that the end of the slides then. In a nutshell, is really what we're doing through Stepping Stones, the crisis that we're experiencing, the crisis that is statewide, and this need to serve survivors isn't going away. So thank you very much.
Thank you. Question. Oh, we're walking away. I know you felt like you were finished.
We will, no, right here.
Move the screen more to the middle. So it's on this side.
See how far I can stretch.
We're over. Sorry.
Alicia, I'll ask you a question. You mentioned, and you saw in the graph there, obviously the dramatic increase in hospital calls. So is there any support that comes from either of the hospitals that helps fund Stepping Stones?
Actually,
Yes.
no. But I will say along the same lines, you might not be familiar, we've actually provided both local hospital clothing for survivors, because if we did not, they would go home in hospital gowns because their clothing is collected as evidence. So no, we do not receive funding in that capacity. And then Jen mentioned, pre-COVID and post-COVID, and something I'd like to point out to really show, Jen mentioned our staff that just take that hiatus allowed by concept dedication to what we do. Our staff was also in both hospitals when PPE could not be found during the height of the pandemic. We did not stop serving survivors. We have had staff walk to the hospitals in the middle of snowstorms, truly traipsing through feet of snow. It is really a uphill both ways and commitment to serve.
This is a strange observation, but I've heard Stepping Stones for a long time. I would never have equated this program with that name. Is that a name that's kind of universal across the state? Everybody knows what Stepping Stones is except me?
No, every center and every program throughout the state has a different name. I had recently had a conversation with the first director of Stepping Stones, and I asked her, where did this come from?
Yeah.
And she actually said when it was being developed, there was a class at ISU that was like a marketing class, and it was a project for them to come up with a name and then vote on it. And the idea behind it was your path to healing in small steps. So we're offering stepping stones for the survivor and their path to healing.
And actually centers across the state of Illinois, I would agree with you. If I saw those names not being a staff member of YWCA, I too would not know that they are rape crisis centers. They're typically, it's typically, in the little tagline, but like sojourners. I would not equate that with domestic or sexual violence, et cetera.
And I thought it was for children.
I can see why.
Stepping.
Yeah, unless it's hard to know. Yeah.
And we do serve little ones. And that is another piece, especially, and this is coming from being a mother. In our building, kids belong upstairs. Childcare is upstairs. Childcare is our gym. Childcare is not our lower level entrance. And so when we have children waiting downstairs, it's awful. So being able to have this extra layer of security and confidentiality for families who are sitting there waiting for some horrific pieces in their life, it just really is necessary.
In order to resume services the way you did before funding cuts occurred, how much funding would you need and over what period of time in order for you to get back to that level? And then is there a path to sustainability when we know that some of the funding from other sources could kind of change at any moment?
Absolutely. So, and I'll only speak for my tenure at YW. I've been here for 5 years. And so we have been able to really make some things sustainable that were previously not done in terms of having like a true development effort and these pieces in place. In terms of stepping stones, we've never had specific appeals. Previously, it was solely grant funded with a very small smattering of private funding. And so when we look at the community response to this expansion piece, we've been able to have conversations that just wouldn't have been able to take place previously. And so we plan to really work with those donors to keep that sustainability of the program moving forward. We've seen a huge increase in new donors, lapsed donors, all of the things in terms of coming out of the woodwork really to support this program. So when we're looking at sustainability and funding, 3 years is generally kind of that sweet spot for funding over a 3-year period to really allow the program to say, okay, this is working, we're going to tweak these few things. And the total amount cut was hundreds of thousands of dollars. So when Liz German and I, our CEO, were talking about $100,000 a year for 3 years would be really about what would allow us to kind of get over this hump, because then our expansion would be done. We expect this expansion to be complete by, I'm going to say it again, manifesting next summer. And so that'll be great.
It will be.
Yes, we just keep saying it's going to happen. It's going to just be great. There's going to be no supply chain issues. It'll be perfect.
And while VOCA is not going to go back up in any foreseeable future, as what we've been told, I do believe that there is a chance that the state will be providing more money through general revenue in subsequent years. I don't know that for certain, but I think that that is an avenue for sustainability down the line. That's just something I don't know as of right now.
Well, and when we look at funding as well, it's kind of one of those things, we pay for it somewhere, right? I always think of that when we're talking about youth as well. We pay for it in the beginning, we pay for it as we're trying to remedy things. We either have funding for a program that supports survivors, or there are detrimental effects in our community as well. The average cost of sexual assault for one individual to a community, to the state, it's about $80,000. And so if you think of it, that's one person, and we're coming as an entire center with that wait list of 62 at $100,000 a year. When we can take what we do and really extrapolate that, we offer EMDR, which is a specific type of therapy for individuals who've experienced trauma. There is a mental health crisis, and that is a very difficult to access type of therapy for folks, and expensive. So yes.
When you talk about, wanting volunteers, are volunteers primarily for the hotline, or do you also offer a volunteering like counseling positions? Or is that all?
It's mostly for the hotline for our after hours, because that's where we need them the most. We do have counseling interns. I believe this semester we have 3 counseling interns. So the need just really isn't there because of the amount of training and the qualifications needed to be that volunteer. Depending on who the person was, I think it was something we could look into on a case-by-case basis to make sure they're qualified to provide it.
And if you leave this room and you think, you're having a conversation and someone might be interested in volunteering in this capacity, we could volunteer for 1 day a month, 1 day a week. And sometimes the nights are entirely quiet, which is what we prefer, right? We would prefer to not have to have stepping stones, quite frankly. There are some nights that are busy. There are some nights where I've taken a single phone call that's lasted 4 minutes. So it's really just being available for that individual or whomever might need services during that time, but it really ebbs and flows.
So we're talking about the people that were on the waiting list. Are there pathways for them to go, like if there are other either community resources or?
There are, yes, we do have referral pathways. A lot of those places also have wait lists. What we do to offer support, I forgot I was going to add this in, for the folks that are on the wait list, some of those people may be getting legal advocacy, so they've got a contact and they have support. They can always call the hotline, obviously, but we also offer weekly check-ins by our advocates. So folks that just want to stay connected, have support on a weekly basis, it's not going to be the same type of intensive therapy that they would be getting with a counselor, but it is somebody who's there for them, to believe them, to listen, understand, and help. So we offer that while they wait. Trying to think of- we can maybe talk.
Thank you, ladies.
Thank you so much.
Thank you.
Really appreciate it. At 4B, we have
One of the things that I've done with the mental health action plan is I've taken all the different recommendations that have the word data. And that data evaluation, data collection, and combine them all into one group of things about data so that they're all come back together again. And so I've been meeting individually with people that have data or have potential to provide data, and just getting some basic general conversation going around the topic, because this is a very sensitive, complex topic. And so there have been some very good conversations. And so I'm not done meeting with people. I've got more people to meet with, and I'm just keep doing that. And if anybody has any questions, let me know.
One of the things that you had mentioned to me was the opportunity or the potential for us to have a refresher in our sequential to update that for us, and we're looking at different sources for that. KOIC, Scott Block coming and doing a refresher. In the past, we had had one completed by PRA, the research consultant group. And did that. So I guess I'm asking this group, helpful, do you think that that would be? It's typically done every 4 or 5 years, I believe, and you progress in the different intercepts. And with us potentially starting a family treatment course, the other efforts that we accomplished through the mental health action plan. I personally think it would be helpful for us to do an update.
I think politically it's pretty helpful, because when you get pushback from constituents and taxpayers, they do want to see results.
And it kind of ties in because there is a document about data across that continuum. So that can tie in very well with some of the things that I've been doing.
Not that it's a political comment. Our very fear is anytime we can show any kind of demonstrates progress that there's an ROI for community investment doing, and that there's a realize that there's a plan and there's targeted work that we're doing, and maybe these fundings help support, helps us tell the story.
Yeah, currently there's like anecdotal, but it would be nice to have some facts like data. So.
All right, well, Kevin and I can talk a little bit more and see about getting that set up. Try to do that maybe in this year, early in this year. We've done it before, I don't think. Let's Scott Block.
Or next week, I can.
Oh, what on? Yeah, that'd be great.
Any other questions? Item 4C is housing navigator for. Morning.
Where?
You really good actor there.
I guess it could have come through the.
That would have been more dramatic.
Yeah. A little out of filter because a few months ago I was in this room for jury duty. So.
Can you use the mic, Kathleen?
Oh, I love a microphone. Hello?
It's popping on, yeah. Get the surround sound.
There we go. Yes, thank you.
Awesome. I know it's very hard to hear back there as well.
It's-
All right, so thank you for queuing this up. And I do want to watch my time. I want to take about maybe 5-7 minutes and give you a really quick overview of this topic. Housing Stability Navigator, and I'm going to tee this up as an introduction. And if agenda would allow in a future meeting, suggest that you actually have the Housing Stability Navigator come and speak to what she is getting done. I can give at the end of my presentation a 60-day update from her, but introducing the Housing Stability Navigator is Janet Hood. And maybe that's a name familiar to some of you in this room. She had a very long and illustrious career with Broman Healthcare, now Carl Broman. And then subsequent to her leaving there, she, I think, worked for the health department during COVID. So very much somebody who knows the community. She serves currently on the Heartland Board of Trustees, I believe. So somebody I've known for a while, and I'm very confident in her ability to forge a path for this role. As you can see there, her contact information, Mid Central Community Action stepped up to be the host organization for this position. And I'll talk a little bit more about how that came to be. Let's go to the next slide, and I'll come back to her information a little bit. There we go. Okay, so all of this is in the context of the Housing Coalition. And as noted there on the bar at the bottom, data, navigation, and funding. Those are probably the 3 words to keep in mind as far as what does the Housing Coalition do? We are constantly talking about data. We are constantly talking about navigating a system that is otherwise, I don't want to call it broken because there's a lot of people doing a lot of good things, but it's very fragmented, very siloed. And then of course funding, what funding is available, what funding do we need? Let's go to the next slide. Who is the coalition? It is a broad scope and broadening scope of stakeholders. Out there is a little bit small, so I'll go ahead and kind of read it for you. In the beginning, when we first started, and in the beginning it came together because of the pandemic, led by efforts from United Way, McLean County, as we stood up a number of coalitions during that period. This is the only coalition that continues to exist to this day. We sunsetted all the other coalitions, food access, childcare, youth programming, so forth. So this is the only one that really continues, and I think the reason is obvious. And what's happened is that it's, in the beginning, it was more about surviving, right? Utility assistance and rental assistance and working with the property owners and, IDA and just different funding sources that the community agencies were receiving. And then it's quickly expanded then from what was sort of that survival mode to now, does this system even work? And it's being more and more stressed because we find ourselves out of the pandemic with a housing crisis because we've got growth. And unfortunately, we've also had inflation. Those have been 2 factors that just kind of have converged in our community, and it's really, really hitting the most vulnerable the hardest. So, it's expanded in terms of stakeholders. I think we have some 65 or 70 people that come to our monthly meetings from, temporary shelter agency representatives, legal services, education system, unified and district 87 are always there. Government representation. We have more increasing interest from faith-based organizations. And I put the employer on there because guess who is really interested? Rivian, you're absolutely right. Rivian. Rivian employees, sadly, by some calculations, cannot afford a market rate, a fairly new market rate apartment in this community. They are probably making around $45,000 or $50,000 annual salary to start. And some of the new units coming on or to be coming on soon are renting at $1,500 to $1,800 a month. And when, a place like Tech or Young America does their calculations, they recommend that that person making $50,000 not rent for more than $1,100 or $1,200. So when we are bringing on $1,500 and $1,800 a month units, we have workforce who cannot afford housing. So that's just at the market level. There's a whole bunch that are at the more, stressed socioeconomic, lower end that, are just hurting more. So that's why this group has continued to meet. Let's go on to the next slide. These areas have definitely expanded of our concern from data collection. We don't really have a very robust data collection method. We really don't have a handle on the precariously housed. Very specific issues like the temporary housing that's needed during extreme weather. We have warming centers, but we do not have overnight shelters. And then that one in winter of 21, 22, I think that was about 100 people who had nowhere to stay. And the Salvation Army has been that refuge, but due to some code issues, they are no longer online. So if we have a brutal winter, I think it was maybe upwards of 100 people had nowhere to stay, no shelter, no friend whose couch they could sleep on, and 100 people showed up at the cafeteria of Salvation Army. They were able to take that this year. It will have nowhere to go. We focused really more on this gaps in permanent housing. That's where the housing navigator conversations. But just to kind of you see the robustness, I guess, from a very specific issue like this one with the extreme weather situation to as broad as building community awareness. So let's go on to that next one and talk about the navigator. I look at this and it's really about building a process to fill those gaps to help with permanent supportive housing. And when I think about processes, I think about manpower, methods, and machines or tools. And so we were successful in getting the manpower. We were successful. I think that was a great place to start. Janet is very resourceful. She will figure this out. I'm confident. We were able to get funding for this, what we considered a demonstration project. We were looking to 2 to 3 year funding, as somebody said earlier with the previous presentation. Minimum 2 years. 3 years is probably the sweet spot of funding a new initiative. We were able to get about 2 from both the town and the city with ARPA funding. So that was, we were very grateful for that. But with the housing navigator, we still have some work to do. There is still technology to help her with a robust HMIS system. We have one now, it's not well utilized. I could get a whole dissertation into that, but there's still technology to consider. There's still data repository. I mentioned earlier that we don't have a good handle on the precariously housed. We know really well what the HUD funded homeless are, okay? Those who are out on the street and those who are victims of domestic violence. Those are the HUD funded homeless. But there's a whole bunch, there's a whole range of other folks that generally we are labeling as precariously housed, that we don't have a good handle on as a community. So that's still work to be done with respect to the housing navigator. But we've got Janet on the ground, Mid-Central Community Action supporting her, and I think it's a great start. Finishing up then, let's see. I just wanted to go back to the next, go forward. I think I've got the slide again. I want to just quickly say that we are meeting, our Housing Coalition is meeting next Friday. This, like I said, is kind of an informal list of things that we've been working on, but we're meeting next Friday for an extended in-person planning session to try to get a better handle on who we are, what we want to work on going into the future. And in particular, kind of in dovetailing in with some of the work of the mental health action plan work groups, we want to make sure we are not duplicating efforts. There's the mental health action plan work groups. There's the McLean County Regional Planning has a housing subcommittee. There's of course the required continuum of care that doesn't actually meet very often, unfortunately, or consistently. And then there's us. So there's at least 4 that I know of, and we really need to coordinate our efforts. Let's go to the last slide. Just ending where I began, and let me just give you some statistics of what Janet on the ground for 60 days has accomplished already. She says the role is designed to connect residents with available and accessible housing that meets their needs and doesn't exceed budget. She says that she has completed 10 cases for the first month's rent. There are an additional 26 currently in progress. The majority of the cases are working mothers and children with children. These clients were living with family members in hotels or in their vehicles. 70% of those rehoused were employed full-time in such areas as healthcare, service, industry, retail, and manufacturing. So I think that's a great start that she's got after just being on the ground since early July. And like I said, I would very much encourage you to have her back maybe at your next quarterly or future quarterly meeting where she can give some more comments. Thank you. And I'll entertain questions if there's time for some.
Kathleen, so is the focus on finding housing for those that are working in places like Rivian or the case studies that you just mentioned, or is it for homeless?
That's why we're having, I mean, the need is for both. But that is why precisely we're having our planning session next week to really, it's gonna, I mean, one group cannot do all of that. And so we really do need to identify who's going to work on what. And depending on where you're coming from, you know, maybe your profession, one area may be more passionate for you than another. But I think really the need is for both.
I would just add, when we talk about homeless, not everybody that's homeless wants a home. It sounds strange, but there are opportunities, and I can look out my window and see people repeatedly, the same people I know, come back and they sit in front of City Hall and they spend the night there every night. I know that there's a place for them. Some of them sleep in the park on the benches. And know that ultimately there's a place. So it's struggling, but it ties in with sometimes mental health.
Oh, certainly that's Sonia.
So
yeah. And that would be to the point that Cassie was saying, you know, are we looking for that permanent supportive housing?
Right.
Where that person is helped to find a shelter and then through case management is helped to stay in that shelter.
Yeah. In wintertime, they sleep in the stairwells.
I just wanted to add that Invest Health is a new collaborative group being ran by Sally Gamba-Corda. We've kind of, through our housing work group, aligned for more of that permanent supportive housing angle. So I'm appreciative of you hosting this in-person event too, so we can really all kind of talk across these collaborative groups and really set our focus for the community. So thank you for that, Kathleen.
Thank you.
I just wanted to make a comment. One of the things that you had in there, your 2 points about the data and then the technology. And then you mentioned HIMS, which we utilize for the FUSE program to identify individuals that may qualify for that, so that there is quite a bit of an overlap with this data. I mean, data is key on a lot of different issues. And so I just want to make a comment about that. I have a question though. When you brought up permanent supportive housing, Joan, did you guys get that grant for that?
We did not, but it is opened up again and due in January. We'll be applying for 25.
Okay, thank you.
It's the Sue's Landing. So
Yes.
The HMIS system, I'll just say, is in a precarious state in and of itself. It is run by PATH. There's been such changeover in PATH that really nobody understands how to use it. Getting training is expensive. Not everybody as an agency, as agencies across our community utilize it. It's been selected for our COC, and our COC is actually not just McLean County, but a multi-county area. So we're kind of hamstrung by that.
That is something that we've kind of known in the back of our mind, that it's not as complete and robust as it could or should be. And some of the other counties that I've been interacting with the leadership network, they talked about theirs was not, or they didn't even utilize it at all, and then they found out that it wasn't as robust as it needed to be, and they've worked on improving that. So yeah, there's always work to do.
Yes.
I mean, while you're, on the data tech piece, is there anything to update PNIA based on coordinating technology
Right.
conversations?
So there was a spin-off group from the Housing Coalition, like Kevin's saying, with the Bloomington Normal Innovation Alliance, and they were very helpful in showing us that there are products out there that could be a tool for Janet as the housing navigator. That would be that data repository, that would be a place where there could be shared data, secured data. However, it would be a duplication in some cases of the HMIS. And so you think, well, let's just replace the HMIS. No, you can't, because we're part of the COC and we don't have unilateral decision-making on that. So very educational, very helpful, but we've kind of run into a roadblock.
Just one final comment on that. I have had this conversation probably about 6 months with anybody, but at the beginning of the pandemic, it's not just new people coming to town that are having trouble getting permits. Story after story of people who, when their contract would come up because of housing crisis, apartment complexes or rentals would give them 7 days to say it's going to be an extra $200 a month. And you got 7 days to figure it out or you have to be out. And given the crisis, they have really. So it is for people who have been here as well, not just.
And to Kathleen, what she had talked about too, and Cassie, what you had asked about, and kind of hitting on that, this is really kind of the tug pull between, I would say, at least two factions within the Housing Coalition, because the one is the urgent, right? When it's minus 12 out and there are 100 people on the streets, it's about, we are trying to prevent the major catastrophe, if you will. And then on the other side is that underlying, when you think of what Covey says, Stephen Covey, about urgent versus important, right? Well, it's important that we start figuring out how to create affordable housing and get these people that have been here and have been housed now all of a sudden are struggling. And so there's really two big kind of undercurrents right there.
No, I was just saying that. Good point.
Okay. All right. So we'll move on. Item 4D is jolt harm reduction, and Chris Schaffner, I believe, is on.
Hey everyone, my name's Chris. I'm having some problems with my camera right now, so I'm gonna keep working on that, try to get it fixed. But Kevin, I did send a presentation in. If we could have that pulled up.
Okay, it sounds like he might be mobile. Right? Just a second, Chris. We're gonna pull that up for you.
Okay, great, thanks.
Kathleen, was that technology that was being looked at? Was that the Apricot 360 thing?
Yes,
Okay, actually thought that was very cool.
it was, there it is.
Okay.
And not very expensive.
Okay.
Okay, well, thanks for having me today. I'm sorry I couldn't be there in person. I've become a professional meeting goer, so I'm actually en route to another meeting on top of meetings. So I feel like most of us in this room can resonate with that. So again, my name is Chris Schaffner. Historically, I was a substance use and mental health therapist. I worked for a number of years with opioid use disorders, individuals in methadone and Suboxone clinics, residential treatments, outpatient treatments, and specialty courts. About 5 years ago, 2018, I jumped over to run Jolt Harm Reduction. For those of you who don't know what harm reduction is, we'll talk through that just briefly. And then I'll talk a little bit about what our population served are and what services we offer. We've recently, just this year, have expanded our mobile outreach into McLean County. And I'll tell you a little bit about that. I'll share just some of the anecdotal data that we've collected over the last several months. So Jolt started in 2012 after the fatal overdose of Dr. Tamara Olt and her husband Blake's 16-year-old son Joshua. They didn't know that Josh had been using. As best I could tell, he had only been using for a couple of months, but he got a hold of something that turned out to have fentanyl in it. And they live in a rural area outside of Peoria, and they contacted 911, and the rural ambulance squad did not carry Narcan at the time. So they had to call for an intercept from Peoria. And by the time AMT got all the way out there to rural Dunlap, Josh's heart had stopped and they were not able to revive him, even with the Narcan. So Dr. Olt is someone I would describe as having a bias towards action. So she immediately began trying to figure out how we could prevent this type of tragedy from happening again, because whether or not Josh should have ever used drugs or not is irrelevant. This was a reversible, preventable death. And if everybody had the resources available that they needed, they could have reversed this and Josh would still be with us today. So what is harm reduction? Harm reduction is, just simply put, it's a set of practical strategies and ideas aimed at reducing negative consequences associated with high-risk behaviors. So some of the high-risk behaviors that we work with are people who use drugs, people engaged in high-risk sexual behaviors, and people who are experiencing homelessness. But harm reduction is also a movement for social justice built on a belief in and a respect for the rights of people who engage in these high-risk behaviors. And just because they engage in these high-risk behaviors doesn't mean they don't still have inherent worth, value, and dignity. It doesn't mean that they deserve to have bad and traumatic things happen to them. Just because somebody uses drugs does not mean they deserve to die. Just because someone is engaged in sex work doesn't mean they deserve to get HIV, or if someone is homeless doesn't mean they deserve to experience the consequences of not living with a home. So we work in a lot of those areas and we try to meet people wherever they're at. And that can look really interesting because regardless of where they're at regarding their motivation to change their high-risk behaviors, we're going to meet with them and meet them at their point where they're at. So if they're still in active drug use, or if they're trying to moderate their drug use, or they're trying to get sober and achieve abstinence, we're going to walk with them all along that pathway. We're also non-coercive, and we've actually found we have better outcomes when we don't try to force people to change behaviors that they may not be ready to change. And I'll talk about that a little bit more here in just a little bit. So we look at harm reduction through a public health lens. It is an alternative to just criminalizing folks who are engaged in some of these high-risk behaviors. We believe that there are better outcomes and that it's better for the community as a whole when we're able to work with them through a public health lens, if that makes sense. So part of what we do is we do Narcan distribution. So first and foremost, we just try to prevent fatal overdoses. We try to prevent people from dying unnecessary deaths. And we try to prevent the spread of diseases like HIV and hepatitis C, chlamydia, gonorrhea. We do HIV and hep C testing, as well as linkage to care for treatment. We also find that our particular style of engaging people is really effective. As someone who has worked in mental health and substance use and worked with homeless populations for a number of years, we find that when we're able to meet people where they're at the way we do, we're actually seeing more positive incremental change over time that seems to be more sustainable. So some of the folks that we serve are people who use drugs, people who are engaged in high-risk sexual behaviors, and again, people who are unsheltered. All right, so some of the services that we serve, that we provide for folks as well. Overdose prevention services, harm reduction services, peer navigation. So that's helping people. We have peers who are in recovery that are helping other peers navigate recovery. We provide street outreach to people who use drugs, who are unsheltered, and or perform sex work. Again, sexual health, like I said, hepatitis C, HIV, chlamydia, gonorrhea. And then we also work to fight stigma. Stigma is one of the primary, what we believe to be the primary cause of death, is that people are afraid to reach out and ask for help because they're afraid of the stigma that surrounds some of these high-risk behaviors. So some of the data that we've seen And I love this quote from Brene Brown. She often says, Brene Brown's a sociologist and a researcher. She says that the stories are just data with a soul. And I think it's important to remember that when we talk about data, when we talk about numbers, that those numbers represent real lives, real flesh and bones with air in their lungs, with families who love them, although they might be exasperated with their behaviors, they care about them. These are parents, children, siblings, friends, lovers. And so all this data represents those folks. And I think that's really important when we talk about this. So this was a picture taken from an encampment there in McLean County over in West Bloomington, kind of over off of Route 9 on Market Street. This was an individual we began working with. We have permission to share this by this individual as well. But this is, if you don't know, this is in your backyard. And these are the kinds of places that we go to. My outreach team on the streets consists of a nurse and some volunteers. We partner with Fuse as well, and they often provide support for outreach. And we go into places that a lot of other programs won't go into. We go into homeless encampments. We go into abandoned buildings. We go into trap houses. We go into places where drug use is frequent, where drug dealing may occur, where sex work may occur, because this is where some of the most vulnerable people reside, and somebody needs to go into those places to meet with these folks and to connect them to resources if they're interested. We know that our approach works here in Peoria, and we see this across the country, that when we're able to engage people in our services, we're able to prevent things like overdoses. And in the last couple of years, we've actually got confirmation from our Peoria County coroner that we've seen a 50% decrease in fatal overdoses in Peoria County. And we continue to see those numbers in all the other counties that we're present in. We see those numbers continue to drive down fatal overdoses because of the outreach and services we're able to provide. In McLean County, right now, we're only working a couple days a week. I'd love to see that be a more robust outreach program and 5 or 6 days a week. We approximately serve about 40 to 50 people twice a week on outreach. As best we can tell, about 60% of these folks that we serve, and again, these are some of the most marginalized and vulnerable folks, live with co-occurring disorders. And so far, since March of 23, we've distributed at least 2,000 doses of naloxone. It's a combination between the intramuscular naloxone and the intranasal naloxone as well. And as a result, we continue to engage populations that are largely unserved. So think about health inequities and racial disparities. About 20% of the population that we serve are BIPOC. Sorry, there's a not BIPOD, BIPOC, and people from the LGBTQIA plus community as well. To speak back to a comment somebody made earlier about folks who prefer to sleep outside even when there's shelter options, I did want to point out, though, that many of the folks who don't go into shelter don't do so because they're obstinate. They do it for a variety of reasons. Some of them being that oftentimes our shelters can feel incarceral. And if someone's experienced a lot of incarceration over the course of their life, that feels traumatic and triggering. The rules can sometimes feel dehumanizing. If I were to move into my own home, I could kind of come and go as I want, but curfews and lights outs and understand those nuances in communal settings. But it also strips people of agency and self-determination. And so some folks would rather just stay out on the streets because it gives them a greater sense of freedom that we all crave and that we all long for and that are offered to us in our Constitution. But then also, and here in Peoria, I can't ascertain if this is the same in McLean County. In Peoria, every one of our homeless shelters is a religious affiliated organization. So many folks who have been harmed by religious organizations are hesitant, particularly if you're a transgender individual, if you're a queer identifying individual. They often report not feeling safe in those religious shelters, so they'd rather stay out on the streets. They're also, particularly the younger they are, the more likely they are to be exploited and or trafficked even. So they feel safer staying away from places where exploitation might occur, even though that increases risk in many other ways. So just some nuance to why folks often choose to stay outside. But what we report is regardless of whether or not somebody continues to engage in those high-risk behaviors, when people access our services, over 70% of them there in McLean County have reported quality of life has increased. They feel valued and cared for. They believe their life has worth. They're also able to be empowered to reduce harm to their own life, even if they're engaged in these behaviors. And what we have heard from folks we've distributed Narcan to directly is that they have reversed 100% of the overdoses with the folks we're working with. Now, that doesn't mean across the county, but just with those 40 to 50 people we're working with, whenever there's been an overdose that has occurred, people have survived it because they're equipped with this Narcan and other resources to help them navigate those overdose crises. So what are some of the barriers we find that people engaging not just in care with us, but just other social services across the county is stigma is still the number one driver. Folks are afraid of how they'll be perceived and therefore how they'll be treated. Within healthcare, there's still a great deal of stigma for a lot of these marginalized communities that are engaged in high-risk behaviors. There's also a fear of criminalization. People are afraid that because they're engaged in survival behaviors, which are illegal, they're afraid of being charged with a crime and arrested and sentenced, which only then further complicates their ability to reintegrate in a pro-social way after they resolve their legal issues. Felonies just everything harder. And so people are hesitant to engage and to kind of acknowledge that they're engaged in some of these high-risk behaviors. Also, access is a real barrier. Having worked in the treatment industry for almost 2 decades, the idea of treatment on demand just doesn't exist. If I were to get into a car accident, I would go to the emergency department and they would treat me immediately because I had a medical crisis. But if I overdose and I reach out for because I injuries and I want to get treatment to try to help get over my substance use, often an extensive waiting list or a lot of other barriers that people need to jump through to access treatment. So a lot of people just kind of give up. They've learned this feeling of helplessness. It doesn't matter what I do. I'm not even going to try anymore. Finances are often an issue. Cost is often prohibitive, and insurance has some limitations on who can access what resources and for how long. And that really makes a difference on the quality of resources that people access. And then transportation, also making appointments is a challenge. If you're unsheltered and you're homeless and you're unable to make your appointment, I mean, it's hard sometimes to even know what day it is when you're living on the streets, let alone what your next appointment is and how you're going to get there. And then, of course, there's obviously still systemic and institutional structural harm that exists to folks. There's a lot of stigma, there's a lot of misinformation, there's a lot of bias that still exists in the world that we operate in, and many of our folks are acutely aware of that. And so those are also reasons there are barriers to folks accessing services. So that's just a quick overview of kind of what we do and why we do what we do. This is a QR code that will link you to all of our social media and our website and our email. Feel free to reach out if you have any questions. We are hoping to continue to expand our outreach in McLean County. There appears to be a need for it. We work closely with our continuum of care here and their street outreach team. So we work closely with getting people linked to housing. And we look forward to building those connections in McLean County so those who are interested in housing have access to that.
Thank you. Do we have any questions?
Hi. Chris had presented information about Jolt to the Board of Health quite a few months ago based on the users coming to the Health Committee. So you had, at that time, you had talked about, you had ISU students. Can you explain what that was? And are you still doing that with ISU students?
Yeah, so we're not right now. That was a special project the ISU students had where they wanted to put a Narcan box that people could access anytime. And one of the problems that people have with coming in and asking for Narcan is they often self-disclose that either they or someone they love is struggling with substance use, and that can be a barrier. So they wanted to put a Narcan box where anyone could access it. And so they did a project through one of their, I think it was their social work or their psych department. We do work with colleges. We're working with Wesleyan College and their nursing program to get nursing students engaged in community-based health and public health issues like this. We work with a lot of universities in Peoria here, Bradley, ICC, OSF, St. Francis College of Nursing, Carle Health Methodist College University, where we often get social workers and psych students, criminal justice students, and then people entering the medical field. We work with UIC College of Medicine as well. We have residents and med students that work with us. And so they help us often with just ongoing projects during the school year. So we'll be having ICC students joining us here very soon in McLean County on outreach. So a couple days a week, we'll have some students that are going out with us, at least during the school year.
Thank you so much, Chris.
Thank you, Chris.
Thank you.
Chris, but I do have a comment that they will be funding.
What's that? I couldn't hear that.
Sorry, making a statement, not a question for you, Chris. Thank you.
Okay.
Be presenting that in the support harm reduction efforts like Jolt, and so I think that partnership will be expanded as there's a need. That's part of our plan.
Thank you. Any other comments? So I'm trying to be mindful of the time, and we are getting close to 9 o'clock. We do have a couple more items to run through. So first up, we have 5A, Mr. Mark Johntrey with the Regional Office of Education. I believe he's online.
I am, and I will be brief. I've just jumped out of another call. Just 4 quick updates. Bridge Academy, we have started the year with 17 students, 15 of which are returnees, and we currently have 4 referrals. So I guess is by the end of next week, we're going to be up to 21 students at this point. So we're really pleased with how that has progressed since its inception last year. Secondly, a lot of our behavioral health professional development that Tricia Malott is overseeing and delivering is now available on our website. So obviously it's targeted to school personnel, but if there are any community partners that see topics that they might be interested in, you certainly could look at that and see if there's something you would like to join in on. And that's on our website under professional learning at roe17.org. Behavioral health in schools, we're reconstituting that group, and then we're going to meet at the end of September for the first time this year. And so we're excited to get that back up and off the ground and moving forward. And finally, we are continuing our youth mental health first aid training. We've had we've had 2 to this point since the beginning of August. And we have 2 more, one in October and one in November, that we're going to be offering to our schools. So moving forward with a lot of those initiatives, and if anybody's got any quick questions, I'll try to answer them.
Thank you so much.
I've got one, Mark. That's Stephanie. Regarding the behavioral health in schools group, I would ask perhaps that Tricia reach back out with that original invitation. Okay. My staff didn't interpret it as a series of meetings. They interpreted it as individual, like, listening sessions. So it might be good to ask her to kind of confirm that it is.
Okay.
That we do want regular participation throughout all of those.
Got it. Understood what you're saying. I will do that.
Thank you, Mr. Johntrey. Up next, we have 5B, Family Treatment Court with Judge Foley.
Yeah, and I will likewise be brief. Just as a reminder, Family Treatment Court is a specialized court docket or a problem-solving court for parents who are in the child welfare courtroom. So abuse and neglect courtroom is another name for that courtroom. Think of it as a drug court for 1 or more parents who have substance use issues that affect their ability to parent. There are no formalized family treatment courts in the state of Illinois, so we are developing what we think to be the first. So we're being very mindful of that and methodical in terms of our planning. The goal of this program, well, obviously it provides the parents with increased support, accountability, and connection with services.
We have 3 goals. One is to ensure that children have a safe and permanent home within the permanent planning timeframes or sooner. 2 is to ensure that families of color have outcomes that are similar to families that are not of color. And the 3rd is to ensure that parents are better able to care for themselves and their children, seek resources to do that, and then ultimately not return to the abuse and neglect courtroom, which is a common occurrence. We are wrapping up our planning grant from the Administrative Office of Illinois Courts. We have actually received an implementation grant from them that will start October 1, just under $85,000. So our plan is to finish with our planning at the end of this calendar year and take our first clients January 1. So several of us at the table are partners with us. We're grateful for that partnership. It's kind of our
Any questions? Comments?
Did want to let you know, we received a grant from the state to develop a recovery community organization, recovery community center that has recovery support specialists as part of the staffing there. It would be great for them to be involved.
And I agree. I have reached out to Heartland about them providing, working with Heartland on their peer activities.
We could probably provide that
Okay.
through that grant.
Okay.
And we get interns from the program too.
Yeah.
So we could.
They're coming to watch the Heartland at Watch Recovery Court at the end of October.
Nice.
Any other comments? Okay, so we'll move on. McLean County initiatives update. 6A is the Behavioral Health Forum 2023. So Sarah.
Morning. Many of you I know are aware, because I've been kind of shouting it from the rooftops, so bear with me if you've heard me yell it lately. The forum's coming up October 19th. This year it's going to be at Illinois State University at the Bone Student Center. I'm pretty excited about that. We're able to offer 8 different breakout rooms for each of our sessions this year. So that's 32 different breakout sessions. We got topics, everything from a professor doing one on narcissism to Dr. Burgundy Johnson doing one on parenting and self-care. Quite a variety of topics. I know some of you are involved in presenting them. Thank you for that, and those of you that have been part of planning it. We have been able to push back offering opportunities for sponsorship, resource fair, advertisement. We have a little more leeway with the printer than we thought we did, so that's pretty exciting. Those of you that have been able to sponsor so far, thank you. If you are still going to be a part of that, we have till September 28th. There's an online form, paper form, just let me know. And we can get you set up. I do also want to say though, if you want to be a part of the resource fair, you know somebody that does, and cost is a barrier. One of our big priorities this year was to reduce any sort of accessibility barriers for people this year. So if there's somebody that wants to have a resource fair table and cost is the issue, please have them reach out to me. We have worked with multiple organizations so far on that if it is the barrier, and we really don't want that to be the issue this year. With that, I've also kind of been shouting it from the rooftops, but I'm going to continue. If you register by October 9th, there is free lunch this year. It is free. It is from ISU. Can confirm it's very yummy. There's lots of different sandwich options, things like that, but you have to register by October 9th in order to do that. So registration is open. We are working with Carl for doing both CEs and registration, so that is available both on our website. We're putting things out on Facebook. I'm going to be a little obnoxious about that coming up in the next couple of weeks as well. Let's see. We are offering CEs not only for social workers, psychologists, educators this year, but also working with Bar Association to offer it for lawyers, as well as doctors, nurses, physical therapists, occupational therapists. I want to say there's 15 different professional disciplines, medical assistants. It's a pretty wide variety, and everything from, I think the lowest is 5 hours. Lawyers can get 5 hours up to 6.75 hours for educators. So there's a lot of potential for continuing ed credits. Like last year, it's all $10 flat. If you come for the keynote, it's $10. If you stay for the whole day, $10. Lawyers, it is $20, but everyone else, it is still $10 for this year. And let's see, last thing. Oh, last thing is, we did get confirmation from our keynote presenter is Dr. Tara Powell. She is a professor from the University of Illinois who specializes clinically research and also has lived experience dealing with trauma after disasters. That she was a social worker in New Orleans during Hurricane Katrina, and that kind of spurred her research and has worked in everything from cholera outbreaks to is working with the response in Maui. I just talked to her on Friday at length, and she is about one of the most fascinating people I've ever talked to. I am beyond excited to have her come. I'm going to want her to talk for more than an hour. Unfortunately, we just get her for that hour and 15 minutes, but highly recommend coming to see what she has to say. So I think that's everything. I do have flyers if anybody wants any. I have plenty. Anybody has any questions?
Sarah, for the resource fair, is that an application but request also online?
Yes, it is. Yeah. Everything should be able to be found on our website.
It looks like Kevin got 4 minutes.
All right, 4 minutes. Just to piggyback on Sarah, I have no doubt that this is going to be probably our most successful forum to date, and that's due no part to her. Due completely in part to.
Small part.
Thank
All right, I'm making about my 4 minutes to Sarah, and I just want to give her a shout out because that's been a lot of work. And thank you for all of you who have been a part of that planning group that's been going on weekly. I know that's been pretty intense, a lot of debate to get the topics this year, but very excited about that. So again, if you have any questions, please reach out to us. We're about a little more than a month out, so really ramping up for that right now. I just have a few quick updates, kind of the things that I get a lot of questions on. People are checking in on. The first one being the Systems of Care grant, which we have been waiting. It seems like an eternity to get an answer on, and sadly, I still don't have one. The only update I can provide you is that going into ERA Commons, I can see that they have concluded the review of our application, but I have yet to receive correspondence in regards to an award or any sort of score that we've received. So I'm assuming sometime in the next week or two, we will finally hear something. Again, the start date for that is the 30th of this month. So yeah, we'll see. We'll be ramping that up very quickly. That's like the initiation date, but actually carrying out the programming for it is that following month. And so it'll be 10/30 when we actually start trying to get some of those things moving. The second thing that I wanted to update on is that through our youth services work group with the mental health action plan, in our last meeting, we discussed issuing an RFP related to youth services that would help to cover some of the goals that are outlined in that section. We had an initial discussion about that. I've been discussing it with administration, and hopefully by our next youth meeting, we'll be reviewing a final RFP and then putting that out to the public for submission. And so we're really happy about that. And I appreciate all the input as well that I've received while crafting what that RFP is really going to look like. Cassie touched a little bit on the opioid funds and how we'll be utilizing some of those to create some programming or potentially a position that is in line with a little bit of what Jolt is doing with harm reduction. We'll be working in conjunction with some other community organizations, and we'll have some more announcements about that, if not before our next BHCC quarterly meeting, during that meeting. And then the last thing I wanted to bring up is that we've been having a few presentations with the state through Scott Blog. We've started to get some pretty intense interest in our Fuse program and the successes that we've had. And so we did one presentation for Scott Block and Champaign County and their leadership over there in behavioral health. And they were really kind of blown away by it. It wasn't me. I had Sarah in the room with me and our nurse, our supervisors, our staff from Fuse to really back me up and kind of round out the vision for what Fuse really is and what it's meant to be. And they were kind of so impressed by that. They've invited us to come and do an hour-long presentation for the Supreme Court Mental Health Task Force. And so we'll be doing that at the end of this month. And if anyone who's a part of BHCC would like an invite to that, I'd be more than happy to extend that invitation to you. Any questions on those updates?
Let's just turn that off. That was excellent.
No, but a comment on that is a couple of years ago, the legislature actually approved a bill that's called Housing is Recovery or something like that. And basically it is nothing but the Fuse program.
Right.
But it's unfunded and there's no funding. So hopefully it would be really great if the legislature
Right.
would actually fund that program, that we could apply for some of that funding. So.
Yeah, I think they're trying to like leverage our successes in some ways to kind of get that concept across, so.
Follow up on the harm reduction.
Sure.
Update. You're thinking about adding a staff.
Yeah, so we had presented to administration a position that we had titled Overdose Prevention Coordinator. And we were hoping to place that somewhere in the community. I've been in talks with Chestnut, via Ross, Matt Mullenhour, and started talking with them. And our initial conversation about, how that might look for them. I heard that there is some other investment from other local entities, also in harm reduction. One being the city of Bloomington was trying to, and this is just what I heard through the grapevine, that they were going to try and hire a halftime person as well as having a Narcan vending machine. And so we started discussing what are all of these efforts that are currently being made and how do we kind of coordinate them so there's not overlap where there doesn't need to be. And so that's still kind of going on. We have we did come up with a position for our initial pitch to administration. I'm not sure that that's 100% what it's going to look like, but still trying to feel that out to do what's best for the county again to reduce that overlap.
Thank you.
Next item is our next meeting is Friday, December the 8th. 7:30. And I think that is it. So, is it? Thank you, everyone.